Here are the different screening recommendations for colon cancer according to American Cancer Society. 1. Colonoscopy. Colonoscopy is a type of colon cancer screening test that uses a flexible tube with a camera to examine the inside of the colon. It is recommended that people at average risk of colon cancer begin regular screening at age 45 with a colonoscopy. The test is usually repeated every 10 years if no polyps are found. If polyps are found, the timing of the next colonoscopy will depend on the size and number of polyps. 2. Fecal occult blood tests or fecal immunochemical tests. These are tests done on the stools of patients to detect small amounts of blood that are not grossly seen. This might indicate the presence of polyp or cancer, hence a follow-up colonoscopy is recommended if positive. This is done yearly for people at average risk starting at age 45. 3. Stool DNA test. Stool DNA test is another type of stool-based test used to screen for colon cancer. Unlike FOBT and FIT, which detect small amounts of blood in the stool, fecal DNA tests look for specific changes in DNA that can be a sign of colon cancer or polyps. They are better at detecting polyps than FOBT and FIT but are also more expensive. This test is recommended every 3 years starting at age 45. If the test is positive, a colonoscopy is also recommended for follow-up. 4. Virtual colonoscopy. This is also known as CT colonography, and this is a non-invasive imaging test that uses computed tomography scans to create detailed images of the colon and rectum. The images are then combined to create a 3D model of the colon and rectum to which polyps or other abnormalities are determined. If no polyps are found, the test is usually repeated every 5 years starting age 45. 5. Sigmoidoscopy. Similar to colonoscopy, a camera attached to a tube is inserted into the anus but only up to the lower part of the colon, known as the sigmoid colon. Sigmoidoscopy is less invasive than traditional colonoscopy, and it does not require sedation. However, because it only examines the rectum and the sigmoid, it may miss polyps or other abnormalities in the upper part of the colon. For this reason, sigmoidoscopy is usually combined with another screening test, such as stool-based tests, to provide a more complete picture of the colon. This is performed every 5 years starting at age 45. The decision about which screening method to use depends on a lot of factors. Cost and insurance coverage also play a huge factor in the decision and personal preference. Consult your doctor if you are already 45 years old and above to discuss plans for possible prevention or early detection of colon cancer using these screening tests. Thank you for watching. Hit subscribe for more essential health information.